There's a formal, meetings being recorded, by the way, because Zoom records everything. I'm going to dispense with the meeting notice pursuant to Governor Baker's March 12th, 2020 order, because everyone who's on the line has been here before. Anybody have any objection to that? Hearing none, we'll go to the agenda. Call to order. So we have 2 sets of minutes to approve. Sue, did you get a chance to look at those?
Yes, I have. I've looked at the minutes.
Do you have any substantial changes?
No, just like apostrophe here and there, but
Okay,
it's fine.
Okay, Jean?
No, I have not had a chance to look at them.
Okay, so we're,
I make a motion to accept the minutes.
second.
Can I just interject a second?
Sure.
On the May
Go ahead, there is
7th
one.
minutes, it should be, my LOA should be May 20th, not the 5th, through July 24th.
Okay, we'll make that, Jessica, you make that correction?
Yeah, absolutely.
Okay,
Thank you.
so there's a motion to approve the minutes for the last 2 meetings. I hear a second. Me, I'll second. All in favor? Sue?
I'm in favor, Sue.
Okay, Jerry, favor. Jean?
I'm abstaining. I haven't had a chance to read them.
Okay. So I'll put a caveat if they've been approved, but if Jean has any substantial amendments, I can reopen them. But at this point, we'll approve them and move on. I have 10 minutes of, I'll reserve 10 minutes to public comment. Let me start with Peter. You have anything you need to ask us?
I'll wait till the end before I ask any questions, if that's okay.
Who's got the highest ranking here, Doug or Joe? Douglas, are you muted? Joe, Doug,
Good Lord.
Doug
is the boss. I am simply here as a citizen. I'm not here as a selectman unless you.
Fine. Mr. Moglen, anything you'd like to comment on as a public person?
Neither. I think you guys are doing a great job. I'm very interested to see what comes out of this meeting, and obviously the governor's committee's report coming for Monday.
Yeah, I think that's the anxious part. Everybody's waiting for Joe.
Guys are doing a great job like always. And same thing, everybody can't wait till Monday.
Okay. Kate, public person, you have anything you want to add?
No.
Okay, all right. So we'll move on to the health director's report. Ms. Spencer?
Okay, the health director's report for 5/14/2020. For perk tests, I conducted perk tests at 25 Woodside Drive, 1 Blackberry Crescent Circle, and 27 Honey Pot Road. For final septic inspections, I conducted them at 7 Falcon Crest, 16 Sawgrass Lane, and 62 Miller.
My neighbor.
I approved plans for 11 Sawgrass Lane and 47 Tannery Road. I am adding in, now that, the direction of how things are going is a little more stable, I'm adding in approving new septic plans and inspecting new septic plans, but keeping in mind that they are not at the forefront of my inspection list, but given enough time, I'm able to fit those back in. Let's see.
Hey, let me ask a question. Where's Blackberry? Is it Blackberry Lane? Where is that?
Off of Laurel Ridge.
Oh yeah, it's Laurel Ridge.
Oh, okay. Yep.
Off of Laurel Palm, right?
It's up there.
I know where it is. Yeah, I know where it is now.
Yeah. So over the weekend, there was a fire at Village Pizza at probably started somewhere in the overnight of Saturday night and rolled around rolled into Sunday morning. The fire damage was really more like a static electric fire in a container of rags that were freshly laundered. and put in an office in Village Pizza. The fire damage was limited only to the office, but of course, water damage in any kind of establishment flows throughout. So they called in CRS to clean it up, and they were able to open within 2 days. Really, the only thing they had to do is clean up a little bit of fire damage in the office and deal with some phone line issues, and they were good.
I'm sorry, I've been going by there and I haven't seen them open. I don't know if they opened today, but they weren't open. What's today, Thursday? They weren't open Monday, Tuesday, and Wednesday that I know of. So they may have opened today, but.
Oh, I thought they were open on Wednesday.
Maybe.
Yeah.
They could have, but I asked the owner if the sprinkler system was attached to the fire department, and he said it will be. So it wasn't. So he had water pouring out of his sprinkler system for the better part of 12 hours.
A lot of water.
A lot of water. So.
I have a question. How did you say it started, or do they not know?
They do. There was it was just a laundry basket full of rags that he had brought just to get laundered, and he put it in the office. And with the oil or grease that's in the rags and the static electricity due to the dryer, it caused a spark, and it started a fire. According to Chief Anderson, that's very common.
And ironically, there was a bottle of bleach in the basket, and the only thing that melted was the bottle, and the bleach didn't catch on fire for some reason.
So they were in the dryer and they caught on fire.
No, they weren't. They were taken out. They were laundered at a laundromat. And
they were laundered at a laundromat.
Yep.
I guess I don't understand. If they were already clean, how could a fire start?
Because of the static involved. Have you ever taken clothes out of a dryer and had the static electricity form?
Okay, yes.
So static plus grease from industrial materials, like say in a restaurant, will cause a fire sometimes to happen. It was just sort of like a kind of a magic connection of all those things. So it doesn't happen very often, but it can.
And they didn't have a flow detector on their sprinkler system to.
Well, they did, but it was Saturday night, so nobody's.
Yeah, they had an alarm go off on site, but really because it wasn't connected, I guess.
Oh man,
they did have some problems with their phone lines and everything like that were because the office is like their central hub for all of their like computer equipment. That could have been one of the reasons why all that happened.
Big water bill.
But I'll tell you, like the place is as clean as a whistle. Let's see. So speaking of strange things occurring, so today at Dunkin' Donuts, oh my gosh, I can't think of which the address is. The one that is
South End.
At the south end of town. Mm-hmm. One employee had been just cleaning the floor drains with floor drain cleaner, and another one came along and cleaned with bleach, and it just kind of caused a little chemical issue. I was told by the fire department that although they were 3 employees were brought out by EMS, like they were on their own volition, standing up and able to get out. They just were having a little bit of respiratory problems. Hazmat showed up, and I just actually got a call maybe about 45 minutes ago from Chief Anderson, and the area has been cleared, and they're getting rid of any food that hasn't been sealed up, in cans or in other containers. And tomorrow morning I'll be there to see them reopen. So that's that. So that's my list of non-COVID related things.
Okay, so why don't we move on to COVID related?
Okay, so this week during our Office for Local and Regional Public Health conference call, we were informed that there will be no information given down to the local health departments until Monday 18th about the governor's reopening plan.
Nice.
So
give us notice. That's terrific.
Yep. In the meantime, I've been fielding a lot of calls and emails about reopening plans for businesses. And while I don't have any concrete information to give them, many businesses have been putting in a lot of effort coming up with ideas for what to do when they're allowed to open. or allowed to open to the public. I think that's a really good sign. This week, I met and talked with several businesses, including the Wilderness Experience, which offers swimming and camping lessons. And I went over to look at the site, the American Legion, and quite a few others. I also met with the officials for the WIC motocross. They gave me a presentation regarding how they'd be changing their operations once they were allowed to open. It's a very thorough plan. I believe that they've kind of put together also at the national level. It included some things like eliminating cash contact points, utilizing online services, limiting riders, social distancing. And for now, barring anything else happens, the date for the Nationals has been pushed to Labor Day weekend.
So no crowds, is that correct? No
Right now, that's not determined yet. So, because if the governor keeps a gathering order in place, I'm assuming crowds will still not be allowed. Let's see. And then, last Friday, on Monday, I met with the officers for the Agawam Revolver Club about reopening their outdoor firing ranges. They put together a plan. It's very similar to the one that's utilized by the golf courses. Points of their plan: 6-foot social distancing at all 3 outdoor ranges. 6-foot standard applies to both the shooters as well as anyone observing, no exceptions. If necessary, they will be spray painting these positions to delineate the 6 feet social distancing. Only members will be allowed to use the ranges. No guests will be allowed to accompany the members to either the ranges or observing. They will be instructed to all wear face coverings on the property. And they will also strongly recommend wearing gloves. All 3 ranges are monitored by camera. They have an elaborate monitoring system. There will be members or officers on site to review the ranges to guarantee that members are complying with mandated guidelines. The maximum number of shooters will depend on social distancing, but based off of previous numbers, 9 to 10 shooters will be anticipated at any time, on one time. They will receive recommendations that if a member shoots a firearm and then allows a family member to use it, that they must wear gloves and clean their equipment. They will not be able to utilize the clubhouse, and restrooms will not be available. And that was their plan.
Do you have any problems with that?
It sounds okay to me. When do they want to open?
They were kind of hoping to be utilizing the same, I guess, methodology that the golf courses were using to be open now.
Jean?
Yeah, I have no problem. I think it's a well thought out plan. Thank you.
Yeah, I think that I don't know if we have to make a motion, but if it was up to me, I'd let them open and use their plan. I mean, I don't have a problem with it. Tammy, what do you think? Should we wait till Monday?
I don't. It seems exactly like what the golf courses are doing in my mind.
Sue, you have any objection?
No, I do not.
Okay. Do we need a motion to have Tammy tell them, or is just Tammy tell them?
No, I think we need a motion.
Okay, can I get a motion to have Ms. Spencer, under the conditions presented to her, let the Revolver Club open?
Jean, you want to do it?
No, Sue, you can't.
Specifically just for outdoor range and under those circumstances.
Yeah. Sure.
Right. Okay, I make a motion then.
Second.
As Jerry said it.
Okay, I'll second. I vote yes. Jerry votes yes. Sue?
Yes.
Jean?
Yes.
Okay, let's move on. Okay, that's fine. Thank you, Tammy. That's very good.
Okay. So also, what we've been kind of talking about a lot over the last week or so is the reopening of Town Hall. Maybe it's not the word reopening, but how Town Hall will be operating in the near future. And so one of the things that I had come up with was a phased approach to reopening town hall. And so far, most department heads are, they're in agreement with it. So for phase one, non-essential employees will be returning to town hall while the town hall continues to remain closed to the public. Then for phase two, with kind of consideration of how the status of the pandemic is going, we'll consider opening up the lobby over by the clerk's and treasurer's office up to the public. And then further down the road, phase three, opening up the town hall with increased sanitation and public health measures. This would also be something that we would probably be doing in conjunction with whenever the senior center would be open, because I don't think that it would be prudent to have seniors in the town hall if we're still worried about their safety. And then phase four would be the new normal, whatever that means. Just going by the governor's plan.
Anybody know that we're going to have meetings, committee meetings, board meetings inside town hall? Is that any projections on that yet?
I'm going to go with that would be when we decide to open up town hall to the public, would be when we decide to have board meetings.
That's fine.
Yeah.
Sue, what do you think?
I don't think any time is safe until there's a vaccine.
Well, I don't disagree with you. So, all right. Well, we're not near that decision-making process yet, so it's going to be down the road a little bit, I think. Is that right, Tammy?
Oh yeah. I mean, we're talking about maybe opening up the lobby in June.
Okay.
And that would just be the lobby.
That's just next month.
You know.
So the lobby and what? You'll have someone come in. Everybody will wait outside. How are you going to do that? Are they just you're going to have markers inside the lobby?
It's almost like we'd be going backwards of the way we came in. The door would only be open to the lobby. All of the glass partitions for the clerk's office, I think, were only open except for one. There's hand sanitizer. People in clerk's office would call if someone was dropping it off. I'm assuming we would do it very similar to that, but we're talking maybe June 9th, maybe later. So we still got a good 3-4 weeks out before we even think about that. But it's not set in stone that we would even be doing that then.
Okay.
I really feel that, and the other departments agree, we've been all doing, business has not stopped because no one's been allowed to go in town hall. People have been doing a really good job utilizing the phone and utilizing emails and the green drop-off box. So I don't think anybody really is itching for things to go back where people are coming in the building. So I'm kind of taking it as it goes.
How does it work? Like when people have to get transfer station stickers?
You can do that online now.
They can? All right.
Yeah.
And where do they get the sticker? Does it print out? How does it work?
I think so. I wish Joe has more information on that because he kind of was spearheading the transfer station team.
Joe?
Yeah, he looks like he walked away.
Okay. All right. Well, okay. I can't, my picture's gone away, so I can just hear everybody. I can't see anybody, so I'm blind here. I don't touch any buttons. Okay.
Yeah. Well, we haven't, I think this actually, so from the information that I was given by Carl Steinhardt, I believe next week we might start doing white goods, but don't hold me to that because I haven't had a chance to look at it. But right now we're not, and also like with the transfer station, they were still going to TJ Bark mulch, so I'd have to take a better look at that.
Haven't those stickers been extended?
I don't know.
Doug, did they extend the stickers? Doug's not here either.
Doug, you're on.
Doug's there, but he's on mute.
I'm yelling at the mute button again. So yeah, those stickers are extended through to July at this point, subject to further action if we need to.
Okay. So I have a question. Does anybody think that Has anybody complained that they haven't been, any citizens complained that they haven't been able to go into town hall and do business?
Not that I know of.
Not to me.
Okay, so, so my question is, if we need to keep town hall closed however long, it wouldn't hurt town business except from maybe a psychological point of view. Is that correct?
I'm not really sure who it would be affecting psychologically because as far as I know, most departments in town have not really been they haven't showed me any downside to it.
Now, as long as this, yeah, my perspective is coming from the other side, is from the citizen side.
Yeah, no, we, people, when they call, we've arranged times for drop-offs and pick-offs of things like that. It really, I mean, maybe it takes a couple extra minutes out of your day, but it really hasn't been. I think most people have been pretty they're considerate about what we need to do. And I mean, if you want a service from us, then that's, what you're going to have to do to get it.
There's your vaccine, so right there. Gives us some time. Okay.
Hey, Dr. Asia, can I ask a quick question?
Sure.
So I guess this is more of a feedback from the board, because I sensed over the last week or so from other boards and commissions that as far as using this platform to hold a meeting, obviously it'll never be this, it's not the same as in person, right? There's always something to that. But I'm interested to get any feedback on whether they feel this is totally ineffective as a platform to have a meeting, or if you were to have a public hearing on something, you would definitely never do it. You'd put it off until we have a vaccine or whatever, because this is not the way to do a meeting. So I'm interested for anyone to give feedback on that.
Gene?
It's kind of an interesting perspective. There's a lot of people that have suddenly gotten pushed into using Zoom as a platform to conduct the business of the town that had never used this as a platform before. And so the perspective is sometimes different from folks that have used Zoom, say, for work or for other things.
Jeannie, what do you think?
Zoom is a good tool. However, it's not all inclusive. For example, the Conservation Commission does have public hearings. And at these hearings, the petitioner and the property owner will provide maps, diagrams, drawings, and they'll be able to show exactly what the projected project is going to be. And though it can be done on Zoom, it's not as defined as an in-person meeting. I would honestly prefer our meetings to go back to in-person as soon as possible.
Sue?
I think Zoom is very convenient because you can just dial in, but it is kind of awkward because, when you want to talk and you're interrupting other people, and it's awkward in that sense. But other than that, it is convenient.
So I really miss the personal contact, and since our board, for good or for bad, rarely has guests, I think we could probably social distance, but I think that's a decision for the selectmen on when they're going to open up the meeting. I think this is really good for now, and I think it shows a good example to the rest of the boards that the Board of Health is doing what it can to promote social distancing. But I think at some point I'd like to get back to, being there and doing the meeting. But I think that is down the road, whether it's weeks, months. We'll have to decide. But and it's never going to be safe, I don't think. Till even with a vaccine, you don't know if that's going to be effective anyways. So there's all kinds of balls in the air that we don't know about. But yeah, I'd like to get back to a public meeting in the town hall as soon as is feasible. So there you go.
Thank you.
That's your feedback. How about you, Tammy? What did you think? Since you're a board member, you're there.
Well, I'm very new to the whole attending of board meetings. So I feel like this is all I've sort of ever known at this point. So I guess I'd have to spend more time having real life meetings to be able to answer that question.
Okay, then we can, all right. Doug, does that answer your question?
Absolutely.
Okay, anything else?
Nope.
Okay, Tammy, you want to keep going?
I really have only one more. I think it's more of a comment than something to talk about. So on Monday, and I spoke with at least 4 different health agents in Hampden County. So none of us really have any idea what information is going to be given out on Monday. We really don't. We don't know what we're expected to do, who we're expecting to deal with. Are we in charge of every single business in town? Will the state be sending out, representatives from different types of boards? Things like, we do not license salons. So will the Board of Cosmetology be sending their inspectors out? So it's kind of, it's those things that, we have nail salons and we have other places. So, there's a lot of stuff up in the air, and we don't know what will be up to the Board of Health to be enforcing. And I just wanted to know whether or not anybody thought it would be prudent to be able to ask the help of other sanitarians, or if we can, i.e. maybe our retired health director, Tom Fitzgerald, or somebody else, to be able to help work on that process. But this is only speculation. Maybe it will be a lot easier than I imagined, but.
So my question every week to you, Tammy, is that do you need any more help? So I think
not this week.
I understand that, but I think Monday we're going to have to, and if you think that we need to bring Tom back, or Randy, who lives in town, he's registered. There are people that can help us, I think, if they choose to, and I'm not against us using them if it becomes a show that, everything opens at once and we don't know where to turn to. Sue, what do you think?
Yeah, I think if we need help, we could ask those individuals.
Jeannie?
She's on mute.
Ask them. My wife wants to know how long it's going to be. She's making me suffer.
Sorry, I had a little interruption here.
So Jean, did you hear any of this conversation?
Yes, I did.
What do you think?
I believe, according to Tom's exit, he was allowed like 900 hours that he could still come back and assist in the town. So you can check the amount of hours he's allowed to work with.
Sure.
With
my
Carl, but I hope, I know Tom would be more than willing to help as far as his current capacity would allow.
Yeah, so that has to do with their pensions and former employees coming back to work. But my guess, and I'm not, they'll bet a lot, that during this emergency, I think they may waive those rules, but we'll cross that bridge when we come to it. But that's my guess, if I was a betting man, that someone would come up with an order that would allow us to use people if we felt it was necessary. We haven't crossed that bridge to that bridge yet, but that would be my guess. Doug, what do you think?
I don't really know.
Okay.
I mean, I think we've given, we have some latitude as far as bringing in additional people and help, and under the direction of the emergency order, the CAO and the chair of the Board of Selectmen can authorize, hiring of anybody below a department head. If it's a new employee, obviously, if it's bringing someone back on a contract basis or something like that, that could probably be done with Carl directly. And like I said, I think the same advice as last time is we just need to keep track of all the expenses.
Yeah.
So when the day comes that we can apply for some kind of reimbursement. But Tammy, you raise a great point. Like there may be people that consider themselves phase 1, but they might be really phase 3, 4. We don't know. And, I don't think you could humanly be the phase police.
Yeah.
you know, if, you know, we even had that with some of the essential versus non-essential businesses, right? Some decided that they were essential and it was kind of a borderline call that, you know, but this is going to be to a greater extent, even for businesses that are going to try to open under phase one. And maybe the direction will be clear from the governor, you know, and I'll use hair salons just as a you know, pulling one out of the air is, you know, that probably to me would be a phase 2 one, but I don't know. But, you know, some places may consider it, you know, may try to open anyway. And then who's to, you know, is that your job? Is that the cops? Is that cosmetology, like you said? I don't know. And how could you possibly be, you know, expected to be everywhere at every minute to see what's open? You know, the citizenry have been very good about calling when they see something that doesn't look right. But that does stretch the resources very thin.
So I'll stay on the hair salon because we had the problem with the golf course, which I don't need to go into, but I think at least some of the salon, the one I've been in contact with, what I go to, she has a very, very detailed plan on opening with PPEs and stuff to keep everybody safe. As safe as, I think, a lot safer than if you go into Big Y. So I know these may not be judgment calls on our part, but I think Tammy may have to make a decision on business by business and what they can provide for a plan to keep everybody as safe as they can. So,
well, I'm hoping that what the governor provides us, I would not have to be doing it business by business because there are so many businesses in town. You know, even the ones you don't even think about, you know, just the industries and machine shops and, you know, auto body and there's so much.
Did you see the pictures of the bars in Green Bay yesterday?
No.
Wisconsin, when they threw out the governor's stay-at-home order. So the bars in Green Bay, the city gave the bars permission to open, and they were packed, shoulder to shoulder. So the only thing that's going to happen is that the incidence of COVID-19 is going to spike in Green Bay within 2 weeks.
Jerry, did they have masks on at least?
No,
Nothing.
No, nothing. But they were. So
Wow.
I don't know if it's not really important. There's a Republican legislature in Wisconsin. There's a Democratic governor, and the Republican legislature went to the Supreme Court of Wisconsin, which has 4 conservatives and 3 liberals or whatever, Republicans, Democrats, said that the governor's order was an abuse of power and he needed to go through the legislature in order to promulgate it. And so they voted 4-3 along party lines to let that happen. So Green Bay said you could open. The mayor of Milwaukee said our Board of Health stay-at-home orders still apply. So, you know, so it depends on who the mayor is or who decides who opens, who doesn't. So they took it away from the governor, and so the mayor of Milwaukee said, "Don't be opening. I'll be after you." So it depends.
If there's a stay-at-home order in place and there's still a face covering mandate, a lot of these places cannot operate. You can't go to a restaurant and imbibe in drinks and food and wear a mask at the same time. So I don't think those two things are going to happen simultaneously.
I'm on whatever happens on Monday. I'm ready. I'm supporting. So that's okay. So
I have a question. This is Kate. Is there any advantage to, and I know it's Thursday to Monday, but would there be any advantage to send out one of those messages just to, you know, kind of prepare people that we don't know, like there's unknown, but we're looking for cooperation in terms of implementing what the governor is asking us to do, so that people at least have been informed that that we're looking for their cooperation and patience with this phase out.
I've thought about it, but I don't know how well Code Red registers to the businesses as opposed to the individuals.
Gotcha.
I think it registers pretty good myself. I think that they'll get the word. Myself, I don't think it's going to hurt. Somebody can draft a little, hey, the governor's notice is coming down on Monday. We don't know what it's going to say, and before you decide to open, you might want to ask for some guidance. I don't think that's a bad idea, and like you said, the citizenry is really our best eyes and ears. So, I mean, if they still say that you have to wear masks inside of a restaurant, if Victor decides to have people in his dining room, I guess that's not going to work, and or Timmy or whoever. So, I think giving them a heads up that first of all, I think they all should know that we don't know what the order is going to be.
Right.
We're in the dark. And this is going to be as new to us as it is to them. And I think the more information the public has, the better off it is, even if it's very generic. I don't think
I'm just not sure if the Code Red is the right platform for that, because I felt that when we did the face mandate on Code Red, the message was not delivered well to our businesses as opposed to the general public.
Okay, so what do you think?
I don't know what the right platform is to get out to our businesses. I really don't. I mean, I thought, if I sent them all a letter, but I mean, that's a lot of stamps and a lot of different businesses to be able to have to do it again on Monday or Tuesday.
Sue, what do you think?
Does the call go to all businesses, to all business phone numbers?
Doug? Joe, the call goes to every number in town, right?
Yeah, it was a group of numbers. I think we had gotten it originally from Verizon, and then people can sign up additional numbers if they want. But I don't know that we have a list of businesses in Code Red that we could do a business call.
Right.
So in other words, those don't go to every bit. It only goes to residential areas.
I think it's whoever signed up for Code Red, they have the ability to do it, but I don't think they do like 569-0000 to 9999. It's a list of numbers.
Okay. Jeannie, what do you think?
I'm pretty sure that the businesses are going to be keeping their ears open, and they're going to be pretty much following whatever the governor dictates. I think they could ask for assistance if needed, but I don't want Tammy to, think she has responsible to go to every single business, every restaurant, every hair salon. That's just way, way too much.
Okay.
I think if there's a blatant misuse out there, somebody's definitely going to report it.
Okay. So.
Right. So what if I work at, say there's 20 businesses that open on Monday, for example, whatever the number might be. And I have questions. So I'm the business owner. Who would I call? Would I call the state?
Well, you're going to have better luck calling us. Because
that's why I'm saying, are we trying to mitigate calls to the Board of Health when it's really at the state to call into either their licensing board or whoever oversees them at the state level? And that's
currently
the thing I'm worried
they're calling
about.
us. Currently they're calling us.
So the phone's going to ring off the hook on Monday.
It's a possibility.
Monday,
yes.
Tuesday, Wednesday, Thursday, Friday,
one way
Saturday, Sunday.
And so I think if you give them a heads up that we know that the order's coming down on Monday, there are some places that obviously are going to be allowed to open. There are some places that obviously won't be allowed to open.
Right.
And there's going to be some places that may or may not be. So there's going to be a red, white, and a blue. So
I don't even know if I have enough information to send that message.
Mm-hmm. Maybe it should wait till Monday.
Okay.
I honestly feel like that's. I thought about it all at first, and it just seems that we don't even know if the information that they're giving on Monday is information about who gets to open or about how, what's the process coming in. It could just be like, all right, now we're thinking about maybe starting with restaurants in 3 weeks. Like,
okay. So let's wait till Monday.
Yeah.
And I bet you the call tomorrow, Tammy, I would hope that there would be some discussion.
There won't be. There won't be.
You don't think so?
No, they were cutting people off who wanted to have that discussion on Tuesday. So I'm assuming
today.
They won't be doing that tomorrow either.
Okay.
They're going to announce everything on Monday morning, and the governor or their committee is going to announce it on Monday. And so like Monday is technically the lifting of the order, but I don't see how any businesses could open until Tuesday, just based on what the direction that the governor has been saying is like, we're going to announce this on Monday. So,
I mean, they're going to have to go in and disinfect. I mean, there's so many things that they should do before, in preparation to deal with customers.
There is stuff on Mass.com. I'm sorry, Tammy.
Oh, I'm sorry. I have all that information ready to go.
Yeah.
Are you there? Did I lose everybody?
No.
Okay.
But I think, like on mass.gov, there is the prelim data, right, that basically says you're going to need a mask. So that anybody who has a business had best be getting or making sure that their employees have or can get a mask, because they're not going to be able to go to work without one. That's what it says to me. And then there's other, the distancing, and if you can't maintain the distancing, this, that, and the other, those guidelines are already on the website, but specific as to which businesses and other industry specific or business specific things they're not going to talk about it till Monday, from what I listened to the governor today again.
Okay, so we'll wait till Monday. I think we're being a dead horse here.
Right.
So. We do have the town crier sign too that we can use.
Oh, that's a good idea.
Yeah. We don't even know what's going on.
Hey, every now and then one of them just
I mean, what would you, if you put something up tomorrow, what would you even put? Wait for the governor to talk to you on Monday? I mean,
No, but you could put something up Monday.
Yeah.
As far as if there's rules that you could start having them scroll by on Monday.
Right.
That's fine.
Yeah.
I like that.
I like that.
Or the website. Something.
Yeah, absolutely, on the website too.
Something to give people the option to look at that information first before they bombard locally. It might be helpful.
So what I hear a lot is the two outlying sides of the story, and I'll keep this short, is one is, keep everything closed forever or open up real slow, or just let everything open all at once, and whoever's going to get it's going to get it, and then we can keep right on going, and then there's the middle ground of, who do we open and who don't we open. So there's going to be a lot of people who think they're being treated fairly, and there are going to be a lot of people who are going to think they're being treated unfairly. So I think we have to be ready to deal with that, both sides.
Can I say something? I like Kate's idea about having a call go out, maybe on Monday or whatever. But I think it's just important that it goes to the businesses.
I don't know if there's a way that we can ensure that. I mean, I can find out.
Well, who's in charge of that?
Well,
Jessica,
do we have a list of licensees?
I do, but that would, do you mean licensees or businesses? Because
we do have a list.
There are a lot more businesses out there affected by this order than just those that we have licensed in the health department.
So Sue's in favor of some kind of, I think first of all we have to see what our order looks like on Monday.
Yeah.
Okay.
And I have access to Code Red. I now know how to use it. And if it looks like it would be a good thing for a Code Red message on Monday, I'll just kind of review it with like the chiefs and Carl, and I can send that out pretty easy.
Sue, what do you think?
Yeah, I make a motion that happen.
Okay, got a second, Jean?
Yeah, I'll second that motion.
Okay.
What's the motion?
The motion is let you use your judgment about how you're going to handle the governor's order.
Okay, thank you.
as far as contacting the businesses. Is that right, Sue?
Yes, to use your judgment. You have very good judgment, you and Kate.
Okay, so I have a motion and a second. I'm in favor. Jerry, yes.
Jean, yes.
Sue, yes.
Okay, there you go. Tammy?
I'm done for today.
Okay. Kate, can you catch us up?
Yes, of
did everyone
course.
get her nice new bar graph?
Yes, I did. It's a picture of beauty, as I want to call it. But so I have two things, just so the board is aware. Last week we talked about my LOA, and Tammy and I are working with one of the school nurses who has been trained in Maven and trying to get her on board, which she's very savvy with computers. I just think training someone during a pandemic can seem very overwhelming. But in terms of short-term coverage, if you will, I guess shorter than longer, I think that she would be able to do the job.
So is she willing? Is she willing? This person willing to do it? That's my question.
Yeah, she just wants to be very clear about expectations and how to manage whether it's someone who she should take care of versus sending over to the CTC, which I told her is confusing for all of us because everything changes. So just to, keep an open mind, be flexible, and hopefully I can get her trained. I would love to be able to get her trained. She had initial training, but I want to go over like more specific things that she can do that would be helpful. So we're just kind of today talking about expectations, who she would communicate with, the ISIS helpline, like resources that would support her so that she doesn't feel like isolated.
Okay, so you're leaving on Wednesday, is that right, Kate?
Yes, I believe so.
That's the 20th.
Yes.
Okay, so we have to, I assume, hire this person as our temporary health nurse. Is that correct?
Contract.
Well, we have to have a contract, and I assume instead of Kate's name, we'll just put this person's name in, and they'll be at the meeting next week. Is that so?
Well, it's different because Kate is on payroll, not contract. So that would be a different, I guess, line item, right, in our budget and everything.
Can I ask Tammy, have you explored other options to get temporary health while Kate is gone?
I have.
And the options are?
That the other options are overwhelmed at the moment. Yeah. The nurse, the Hampden County nurse, I guess, is overwhelmed with work. And I mean, I can't think of what a different type of option would be other than somebody who's been willing to help us out.
Okay, willing to help us out, or is she expecting an equal amount of pay as Kate you are currently receiving?
Well, I think she should get the equal amount of pay because she's going to do this person's well qualified, and she's going to do what is necessary. Luckily, the graph looks like, unless the opening causes, a rash in Southwick.
Mm-hmm.
So what I understand, this person's very capable, can do the job, and I think she deserves to have the same pay as Kate is getting.
Yes, I totally agree with that. However, she's already a school nurse.
Well, that's
already getting paid for essentially not doing her job at the school. So she's going to be, in my opinion, double dipping.
So that's the question, I think, for the select board, that I think, or the legal people, but her pay probably shouldn't be greater than what Kate's making. If that's a combination of what she's getting as a school nurse and as our board nurse, I think that'll probably work out. So I don't know what they make up there. as a school nurse.
Well, I think that just needs to be explored before we, do training and have
Well,
her
we only
be on
have to
board next week. I think we need to research this a little and find out exactly what the details are before you just automatically say, well, she'll be at our meeting next week.
Well, we have, yeah, but listen, in the middle of the pandemic, I need a nurse for the next meeting. And unless Kate's gonna postpone her plans, which is, I doubt it, I think we need to get this all done Monday or Tuesday. I think that the select board needs to decide what's the legality, how much is she making now? If Kate's not going to obviously be drawing a salary, so if we could make up the difference to what Kate's making, I think that works. I don't think we have any other options. Nothing else. This fell on our lap. We've been very lucky about it. And I think that I know I don't expect her to get Kate's salary and her nurse's salary that she's getting from the school. I don't know if they're getting paid now anyways. Is that right, Doug? Are the nurses getting paid now, their salary?
That's under the school, I would assume. And, okay. And if I could just chime in, because I do have to jump in about 5 minutes for another engagement, but somebody should just let Carl know, because I think this is, I know there's differences with the health agent and who hires the health agent, but I don't know about the rest of the employees. Give Carl a call.
Okay.
And the selectmen have delegated the chair and Carl, like we and I think I even mentioned it during this call. They have the authority under the emergency order to hire and bring resource necessary, anything lower than a department head, to bear. Let Carl figure out the money with the school. Maybe we have to cover her salary from the school and she won't get paid from there. That's not for us to decide. You need Jerry, I agree with you. You need a nurse. And if I don't think she's going to end up getting double paid, it'll have to get worked out, but get Carl involved sooner than later. The Board of Selectmen's not meeting next week because there's an election on Tuesday, so we can't meet. And we have not scheduled an alternative meeting date, but like we said, we've already delegated that authority down to the chair and Carl to make those decisions, personnel decisions below a department head, especially for someone filling in for Kate on LOA. This should be a no-brainer. And the money shouldn't be that, I'm sure there's precedent on how you handle borrowing an employee from one department and you move their payroll from one to another, even interagency.
Okay, so Tammy, you want to make that call? You want me to make it?
No, I will. I will. I have to discuss quite a few things tomorrow with Carl anyway. I also wanted to just, I know, huh? No, he's been so great.
I know it, but it's like every other answer ends with, we'll check with Carl.
Check with Carl. I just want to sort of line out how I kind of expect coverage to sort of go out from here. So I also took the Maven training. I've been figuring out how to run the addresses so that I can give them periodically to the fire and police. So Marcia won't have to do that. Okay. If we, and I think Kate, you explained this to me. So when a positive case comes in, I was really happy to see that when a positive case comes in, like you get an email sent to you. Like I was wondering whether or not I'd have to fish around the website, but that was really helpful. So, I mean,
can I just throw a caveat to that? I've been fortunate that I have not had floating cases hanging out. Like every time I get an email, I go into Maven, I open it up, etc. Some towns I think that are bigger have lost cases in their workflows, but our workflows are small volume. So if you decide to take over that ISIS connection to the link, there is a way to check the workflows, but I have not seen any cases get caught in the middle and not be addressed. So that's some peace of mind, but you can always look and see if there's anything in the workflow. So would you want to be that person that would get that email?
I am getting the email now.
Okay.
I mean, I'm not touching them just because I don't want, like I'm not touching the cases, but
Tammy's worked enough, and if Marcia can help, can do it.
if she can get on there and click send to the CTC,
Yeah.
and I talked to several of my counterparts in other towns this week, and they have all well, almost all of them have decided to let the CTC handle cases from here on in. That way, at least, you know, Marcia, she wouldn't be overwhelmed, and I would use her if we had other reportable diseases. I mean, I'm not a nurse,
Sure.
so if someone came up with pertussis,
Mhm.
we
Yeah.
would need her to handle that kind of thing.
Right.
But I mean, COVID wise, I think I'm pretty confident on being able to do some of this stuff. So, but I might pick your brain on a few things, Kate, before you go.
Mhm. Sure.
So,
The only caveat that a CTC would send back to the board is if they're hospitalized, or if there is a defined cluster, if you will. Like if we had a nursing home and somebody was added positive to that cluster, that has to stay locally. Those are really the only two caveats. Everything else can go to the CTC.
So are you there?
Yeah, no, I'm listening.
So are you?
I just,
go ahead.
I forgot what I was going to say.
Are you in favor of letting Tammy use her discretion and hire? Well, it's Marcia Lamoureux. Let's not be around the bush here. So, so are you in favor of having Tammy work with Carl and Marcia to work out the money problem part of it, and let them use their discretion to equal Kate's salary, however the town wants to do it?
I don't think
So-
we have a choice.
Okay, Jeannie? Jean, you there?
Yeah, again, you really do need to discuss, you know, and I'm not opposed to Marcia joining. What
Yeah.
I am is how the town has to function according to getting her paid. And
Well, I
that,
think- yeah,
I
I think-
believe you have to check with Carl.
Yeah, I don't have a problem with that, but all I'm saying is that let Tammy and Carl work it out, and if Marcia has to sign a contract with us to make up the difference, then Tammy has our permission to do it before the next meeting. That's all I would like to get from the other two of you.
Mhm.
So,
Yeah, whatever Carl advises us to do,
okay. So,
so we
Jean?
can get her on board.
Yeah, I believe I already said that. Thank you.
Okay, so,
Yeah.
okay, Tammy, there you go.
Okie doke.
All right.
So, Kate, we have your cell phone number. You got reception. Can you hear it ring when you're on your
Yeah,
vehicle?
you can still call me.
All right.
Okay. So, Tammy, you said you're done. So, Kate, I read this as we only had one case this week. Is that correct?
Okay, do you want me to go over this? Did everyone get to see
Wait.
the graph I
Yes,
updated?
It's lovely.
Yeah, oh, thank you. I'm trying to use my, my Excel skills, but let me just kind of start broadly. So to date, as of today, there have been 364 residents who have been tested. So what I did is I took 364 and I divided it by the total population of Southwick, which I made 9,700. I don't know if that's exact, but it was kind of a guesstimate. So if you divide that, 3.7% of the population that was positive out of the entire population. So that I'm hoping will be stabilized, right? So the issue of if we have more testing, that people are going to be negative. I don't know what that's going to look like. So
My guess is
So-
that more people get tested, the more positive cases we're going to have.
could be right.
Yeah.
I know. So we have to plan. I think we have to plan for the worst case scenarios, right? And if it's better, that's awesome. So the next thing below that, 46 confirmed, which is really 49, because some of the residents went to other facilities. Okay, I did not include them in the graph. So I have 2 in a nursing home, and I have 1 at the Ludlow correctional system has a wing for first responders that need to be out of their homes. So that's kind of where those numbers come from. And so when we look at all of the testing points of the bar graph, there's a 17% average of all the positive cases. And the range has been from a low of 2% up to 47%. And that 47% would be on your graph. So that would be April 23rd through the 26th. So kind of in the middle of that, that graph.
Well, that's only because we only had 15 cases and there were seven
Right.
positive. So
right. And these are not, again, this not accumulative, but I broke it down by what exactly happened in that moment in that week. So you can see that there's been 2 deaths. And again, if you look at hopefully the leveling off with this week, so 34 tested, 1 positive. We won't know if that remains stable until tomorrow and Saturday and Sunday, etc. But if you look at the week of April 29th, or those 2 dates, April 29th and 30th, right, 81 were tested, 1%, or 1 person was positive. So it's a snapshot in time that we don't know. I hope it trends down and continues trending down. But that's kind of where we are right now.
The fear is, of course, when we reopen, these cases are going to go up, which they certainly will. But depending on
if they get tested, right, that's the only way we know. Do they get tested, and then are they positive or negative?
Yeah.
If people don't have symptoms, they can still be infecting other people. So that's the unknown pot of people.
Can I ask a question?
Yeah.
What is the dotted line, the dotted red line?
Oh, it's just like a trend line. That's what they call it. It's a logarithmic trend line, the red dots. Hmm. That's all that is. And it's looking at numbers tested is what Excel did.
So it has nothing to do with the number of positives, just with the number
of tested.
Yeah.
Right.
So okay. I think a lot of people in town or come into town, they're really abiding by social distancing and putting their masks on, and hope it continues. I mean, people, and we can only do so much.
Yes, yes,
people
exactly.
People need to make a lot of their own decisions, but I think that we have to make some policies that we stick to and not just open up. Okay, anyways, I said my piece. Kate, you have anything else to add?
No, that was it. I just wanted you to know about the graph, and if you had questions about it.
Have a safe trip, by the way.
Thank you.
So you're leaving Wednesday?
Yes, I'm leaving tentatively on Wednesday.
All right, check in with work with Tammy Monday and Tuesday.
Yep. Tomorrow, Monday, Tuesday, whatever needs to be done.
I don't have any access to who is here. Peter, you still there?
Yes, I am.
You have any questions?
I have a couple, if you guys don't mind. First thing, has there been any update to the graduation plan? Has that been approved by more department heads?
So
not that I know of.
Plan? So
what was the question?
Did you look at the graduation plan?
Yes, I looked at the new one that Tammy sent. My concern, well, first of all, we got to see what Governor Baker says on Monday. But my concern is when they all congregate up at the high school, how are they going to do that? They're going to just stay in their cars until they're ready to go down the hill. I don't know where that part is there.
Jean?
And then after graduation, with everybody, all there mingling, just.
So Jean,
Yeah,
what-
you know, I think the majority of what they have planned, and they didn't go into every single detail, but again, this isn't happening for quite some time. If things change, I don't believe the graduation would even take place. If, you know, the cases increase, I think they would be revising any plan depending on how the trend of positive cases come about in the near future.
yeah, so I think if, just to shoot this, I think if it stays the same, I think this plan is really good, as long as the superintendent has a bunch of chaperones up at the high school to make sure these kids stay apart, and she can promise us that that's going to happen, and she's going to only allow 3 people in a car to come in, and then when everything's over, those people need to leave the premises in the same car they came back in. And after they do after that, is, I think I saw one in a parade that Chicopee Comp had the cars go by the school, and they weren't socially distancing for a second. So I think that good intentions are fine, but as time goes by, gets close, I think that was a great plan. I think the hole in it is what's going to happen up at the school and how she's going to take care of it when they come down. That's my problem. So I think as time gets closer, we can get a more definitive answer. But I think that plan is pretty solid and well thought out. The only question is, A, how the kid's going to get up to the high school, and 2, who's going to take care of them up there, and then 3, how are they getting out? So I think those need to be settled. And I think Dr. Willett probably has a good idea how she's going to do it. But she needs to communicate it to us, I think. But I think I would let this go ahead pending, those answers. And again, we've got over a month. She planning for June 25th. Is that what the tentative date is? Anybody have that? Peter, you have that date? Is that what it is?
I think
So
so.
it was June 20th or something,
Okay.
June 20 something.
Yeah, it was late
Yeah.
June, I think.
So I
With
think,
a rain date in July.
yeah, so I think, depending on what the governor says on Monday, I think we can work with her between now and then to iron out what my concerns are. And I think they would hit my number one concern and what's going to happen up at that high school when 115 kids get together and they all think that, this is all great. We can hug each other. So that's my number one concern. So, okay.
Kate, I have a question.
Sure.
About how many of the cases have actually been high school age, in that age group?
Okay, you got an age breakdown?
Kate, you're muted.
There has been none. The youngest that I have seen is, I think, 22 or 23. Nobody younger than
Okay,
that.
thank you. Thank you.
Sure.
Okay. Sue, do you have anything to add about that school?
No, I do not.
Okay. Peter, any other questions?
Yeah, kind of a 2-part question. Not sure if you're going to be able to answer one part, but Tuesday is obviously election day. Is there a protocol for people coming into town hall to vote? Also, how many voting sites are there in the town? Do you guys know?
Just the one, I believe.
Just the one? Okay. So what's going to be the protocol? Is there
A
obviously there's
code
a
red.
statewide mask? Okay, go ahead.
A code red message went out earlier this week about the expectations for the public. Wearing masks, bringing your own pens. I think if you want the exact wording, the town clerk is the one who issued it out, Michelle Hill.
Okay.
And
sorry, go ahead.
I think in it that she's assured us that she has enough PPEs for the town workers.
Oh, speaking of PPEs, either tomorrow or Monday morning, I will have a good supply of masks for the town workers and for the event.
Okay.
I just received news today.
And you're okay with gloves, Tammy?
Oh yes, we did receive those maybe 2 weeks ago, so we're
Okay,
good.
good. Okay.
So Kate, are you gonna turn your gloves in? I'll get them over.
Yes, I
I don't
have
think we need them.
a few. You don't? I can keep them. I have
really-
about 300 medium in my, 300 medium and like 300 or 400 small.
Why don't?
I have thousands of gloves.
Okay. All right. So
I'll
fine.
keep them in my car.
Nobody wants to wear gloves.
Mhm.
Okay.
For some reason. Sorry.
You had a
I love
second
wearing them.
part of the question?
This probably is a question for Michelle Hill, but you guys don't have any data on how many absentee ballots have been sent in yet, do you?
No.
Yeah, I'm assuming that's a Michelle question. I'll ask her tomorrow.
Anything else?
That's it for me. Thank you, guys.
Okay, thanks for attending. Is there anybody else public on the call?
Yeah, could I just get an update on what the numbers were this week? I missed that part, I'm sorry. As
Okay.
far as cases go and all that.
Oh, for so this week, the 8th through the 14th, so we had 34 residents tested and 1 positive, which is 3%.
Okay. Thank you.
And did
You're welcome.
Can you trace that test to into town where they got it? Do we know, or we're still tracking that down?
No, people don't know.
Okay.
Unless they're in a healthcare facility, like as a healthcare worker, then they're pretty sure. But a general resident doesn't know.
Okay.
Does
Or they
this
don't
bring
know,
the
they don't
number?
know. Say
Does
again?
this bring the total number of cases to 49 or 50?
It's 49.
49.
I was off last week. So
Okay.
49. Yep.
Kate, Peter, you're all set?
Yes, I'm all set. Thank you.
Am I not right, Tammy, that the businesses that are open aren't supposed to have picnic tables available? Is that correct?
You're correct.
Okay. I know that the golf course they're not allowing any food to come out of that kitchen. They want to know if they could have hot dogs to go. At the ranch did, and I said no.
No.
You could, I guess you could put them in a box and they could put them in their car and take them off. if
No.
you want. You can't. Okay. No, they can't consume them on premises. Is that correct?
The way it states is that no clubhouse, lockers, or restaurants at the golf courses can be open.
Okay. So I told him no, and I told him they couldn't bring food on to the course either, which is alcohol, which they can't anyway. So,
We'll
I
find
know
out more
that-
Monday.
I can't. Yeah, I can't speak for the ranch, but at Edgewood, I was out there a couple times this week, and he's, except for having his own pen there, I told him, I brought my own pen to sign. He's having people sign a roster, and he has two hand sanitizers next to that, and the kitchen's closed, and everybody's got one cart, and the most he can let out is 4 at a time, and he's getting 10 minutes in between tea time, so he's at the.
Jerry, you said everybody's got one cart. Everybody with a handicap sticker has
No.
a cart.
That's not how it changed. It changed to, the governor said we changed it to anybody with a handicap sticker or certifies that they have a condition that won't allow them to walk the course. So that's the new guideline. That came down. Sue, do you agree with, is that what you have been thinking, or am I get this wrong?
Are you talking to me?
I am, Sue, because Jeannie thinks.
Oh,
that
yeah.
it's just-
You mentioned that that Baker's guideline changed this past week for the golf carts.
Tammy, is that correct?
And yeah, the state confirmed it, and I emailed the wording to both of the golf courses and the Longies, but Longies isn't. They haven't had anybody ask, I guess, to use a cart yet, at all.
So
Jerry, I
everybody-
was just
Oh, and I also wanted to
Oh,
clear up.
Jean, go ahead, Jean.
No, Jerry, you had just said everybody gets a golf cart. You needed to say everybody that is applicable can
Yes,
get a
that's
golf
correct.
cart. Not
That's
everybody. You can't do that general group.
Everybody that either has a handicap sticker or certifies to the club that they have a condition that won't allow them to walk the course can get a cart. They have to certify it in writing.
Thank you. That's what I was looking for.
And the pro is keeping, at least at Edgewood, is keeping a log. And I'll check with the ranch guy tomorrow, make sure he's doing the same thing. Tammy, is
I
that
just
okay
want
if
to
I call him?
clarify that's fine. I just want to
Okay.
clarify that there's nothing that states that people cannot have a picnic table. It's just that any of the places with the on-premises dining, it just makes more sense for them to get rid of it because people congregate at the picnic tables.
Correct. Okay, thank you. Okay. All right. Anybody have anything else, Sue?
I'm all set.
Jeannie?
No, I'm all set. Thank you.
Kate?
I'm good. Thank you.
Have a great trip. Tammy, you have anything
Thank you.
else?
Nope.
Can I
Anybody
just ask
public?
a quick question? Just a quick
Sure.
question. Last week, the American Inn, we didn't have any positive cases from there, or so we thought. And Kate, you were going to check in to see if that was correct or not.
Yes, they had none.
Wow,
Amazing.
Mm-hmm.
that's
That's
great.
awesome.
Good.
Yep.
Okay, I'll take a motion to adjourn till next Thursday at 6.
Hey, Kate, we'll miss you. Have a safe trip.
Thank you very much.
All right. I make
Thank
a
you.
motion that we adjourn.
Okay, second. I
I'll,
vote yes.
I'll second that motion.
Okay, got a motion second. I vote yes.
Sue votes yes.
Jean votes yes.
Okay, we're adjourned till next Thursday at 6 p.m. Thank you, everybody.
Okay, everybody
All
have
right.
a
Thank
safe
you.
day.
Bye.
safe.
Good
Take
night.
care, everyone. Okay.
Good night.
Bye-bye.
Bye.
Oh, there you are.